There's an important adage by a Roman poet, Virgil, demonstrating the importance of health, and it goes like this: the greatest wealth is health. Simply putting, good health improves and optimizes performance. It helps fight diseases and infections, and it also helps raise motivation and awareness and morale. My name is Simeon Uvenico. I'm a health and wellness student at the International University of Management, and I'm pleased to be here with you guys to share with you the most common concerns or issues, health issues in the Kunene region that have been stated under the State of Region Address of 2023. In this video, you're gonna know what these diseases are, what causes them, and ways to reduce the risk of infection of these diseases. Interested in getting to know more information about these diseases? Please stay along, and thank you for your time. Now, speaking about health and it being the greatest wealth, healthy people create a healthy economy. They live better and more fulfilling lives and make better societies as well. Now, in terms of our public health in the Kunene region, we have experienced mostly the most common diseases such as HIV and AIDS, TB, and malaria. Starting off with HIV and AIDS. These conditions have been on the rise every year, percent by percent. HIV can be transmitted through sexual intercourse by sharing syringes, or during pregnancy, during childbirth, or during breastfeeding, and it's the main cause of AIDS. HIV in general weakens the immune system by destroying CD4 plus T cells. Now, CD4 plus T cells is a type of white blood cell that is important for fighting off infections. Now, a loss of these cells from the human body means that the people that are living with HIV are more vulnerable to other infections and diseases. Today, 100% of women that are attending maternal care in the Kunene region were tested for HIV and know their status. In addition, 97% of babies that are born from HIV positive mothers tested negative, while our HIV treatment coverage has increased from 81% in the previous years to 98% to date. Now, a total of 1,358 men were circumcised for the year under review in our region. Now, for HIV, we have something called social marketing. Now, social marketing is a way to connect with others on social media. It's a general definition. Now, the use of these marketing the use of these skills and this practice is to achieve social change, to promote the general health of patients, and to raise awareness and induce changes in behavior, since behavior is one of the most common factor in the causation of HIV and AIDS. To reduce the effect of the spread of HIV and AIDS in our region specifically. From being overall approach. Now, about 80% of sexually active Namibians are not yet positive, not yet HIV positive. It is vital that we do everything we can to prevent new infections. Education and awareness campaigns, condom distribution and testing are the most common important ways to prevent the spread of this disease. We need to have targets. Our campaigns and projects should reach the right people and also make sure that our message is shared across clearly and strongly. With public education, it's a way that is shown and expressed, practiced in forms of talks, workshops, meetings, and all that. Our aim is to get as many people as possible and educate them about prevention and safe sex. We have condom distribution. This is like the best way to prevent the spread of AIDS. But people need easy access. We're gonna get to talk about transport access and access to the hospitals in our poor region in the following slides. The next one is counseling and testing. Use to prevent the spread of HIV and AIDS because a lot of people in our region are living with HIV and AIDS unknowingly, and they are spreading it to their partners, to other people, not knowing, which increases the rate of HIV and AIDS in the region. Looking at the other concerning, tuberculosis is among the leading causes of death globally. In Namibia, the disease has a huge burden, with a case notification of at least 442 per 100,000. Today, Namibia is still among the countries with the highest global TB burden, despite of all the efforts in place to reduce it. Now, this is an airborne disease that is caused mainly by the bacterial Mycobacterium tuberculosis. In our region and in our country, it's commonly known as a poverty-driven disease, and it may cause economic distress, vulnerability, marginalization, stigma, and discrimination among people that are affected by it. The following are symptoms of this disease: a cough that lasts 3 weeks or longer, weakness, fatigue, weight loss, chest pains, coughing up subterranean blood, which is a productive cough, anorexia, chills, night sweats, and pyrexia, to name a few. Now, it can be contacted very fast, and if it's not treated immediately, it might just continue what it does best, which is to kill the infected people and the members of our region. Now, when we talk about TB, we need to look at the geography of Kunene region as well. Now, the inability to reach and observe patients take their medication is the fundamental impediment to the foundation of the DOTS program, which is the Directly Observed Treatment Service, or the Directly Observed Therapy. Now, under this theme, there are following sub-themes that we're going to look at, which were generated from our respective Kunene region. The first sub-theme under the biggest theme is transport unavailability and vastness of their area. Now, to explain why the type of direct observed therapy emerged as a significant factor of our region, it was revealed that transport was one of the major impediments to patients accessing direct observed therapy services in the Kunene region, since the direct observed therapy is one of the most common initiated prevention programs of TB. Now, we've interviewed a few participants, and this is what they had to say. Challenges include no transport, collecting sputum, and seeing if a patient is taking their medication is a very difficult thing to do. One participant identified distance as a barrier of accessing direct observed therapy services, saying that Opua is fast. Some patients stay 180 kilometers approximately away from the hospital, and it's very difficult to reach them for treatment. Now, the second sub-theme is inaccessible patients. Now, under inaccessible patients, we have something called nomadism. Nomadism is a popular type of economic activity that involves migrating with cattle. It's also a specific pattern of culture that influences health seeking behavior and access to healthcare services. Now, this means that nomadic patients who have been initiated on TB treatment may miss out on such services, which is now the direct observed therapy services, over time, owing to their culture. Now, looking at the nomad patients, a further research has revealed that a number of TB patients in the Kunene region were nomads. Now, it's provided to be difficult accessing them once treatment has been initiated. Observed therapy is a World Health Organization approved strategy that have been initiated in the Kunene region regarding TB. That's mainly used for increasing commitment by requiring health professionals, community volunteers, or family members to watch and monitor patients reviewing each dosage. Now, we have one type called community-based DOTS, which is community-based direct observed therapy service. This one involves training community healthcare workers to build knowledge, recognition, and treatment of TB while bringing services directly to the homes of those that are in danger of the disease. Now, fact be told that the region relies heavily on CB dots, which is now community-based direct observed therapy sessions for TB treatment, since CB dots were founded to be the main type of dot method used in the Kunene region. Now, having mentioned what TB is, what causes it, certain recommendations we require as health and wellness students to better improve and reduce the risk of infection of this disease. Now, since the Kunene region is a vast region with diverse terrain, the Ministry of Health and Social Services should consider investing in multiple direct observed therapy points throughout the entire region by making use of refurbished shipping containers. Now, this will serve as an extension of a permanent health facility, which is clinics and district hospitals, that will later infiltrate the region and bring services closer to the people, especially the nomadic patients. Now, these facilities may also be used for increased TB and HIV health promotion. Owing the remoteness of the Kunene region, the Ministry of Health and Social Services could make use of drone technology to deliver medicines to patients and directly monitor their treatment. Now, this will be an expensive exercise at first, but could work just as good as physically requiring TB field promoters observing the patient, for instance. Now, the Ministry of Health and Social Services should regularly train HIV and TB promoters on improving the delivery of health education in the Kunene region. Now, before treatment initiations, the Ministry of Health and Social Services should have a robust information package for all patients whose delivery is being monitored. And this ensures that all patients have the required standard and improved knowledge across the board. The region should, in the end, invest extensively in recurrent health education to demystify HIV and TB disease and its management. This could improve knowledge on how patients must take their medicine and potentially reduce the stigma that is associated with TB, specifically during direct observation therapy. At the same time, emphasizing the patient's responsibility in their disease treatment. Some of the methods that can be used could be a recurrent radio and community meetings. Now, having said all that, those recommendations to be put in place, like we all know that our region is the region of endless possibilities, and if we all come together as a community and as a country and as a nation, we can better and decrease the risks of infections of those diseases, and hopefully one day we can eliminate them by following procedures and by working together as a team. Thank you so much for staying by. Thank you for your time. God bless.